Over to you, Gururaja sir. Can you please explain this case for us?
So he's a young chap, aged around 32 years. He has come to me with a similar type of slightly forwarded protruded belly in the last year, 2020. That time also I have treated him on the lines of Nityameva Virechaya, the concept of Jalodhara or Yakruta. So he recovered within a short span of 1.5 months. So later, he felt that he has recovered totally and he has not followed my instructions. And I, even with all repeated communication to him, he was of the opinion that his everything was normal by that 1.5 months treatments. Then why you want to continue the treatment? So he left the treatment last year. After that, this year, almost from that time to this time, some 10 months later, he landed with a severe condition with a heavily protruded belly, with a lot of ascites, as well as even the pedal edema to the gross. Is one of leg is also having a lot of vasculitis because of the pedal edema, and as well as even there was a cellulitis and even totally his 3 or 4 places he had a wound which is oozing out continuously because of edema. So it's a classical case of chronic liver disease, which we keep it in Ayurveda as a Yakrit Alyodhara, and one of the varieties of Udara, wherein we try to analyze the things, of course, based on the Ayurveda lines. And if it is taken in Ayurveda, it is treated as on the lines of Kumbhakamala. Very clearly, it is said in Kumbhakamala is Kalantarat Krichirasyat Kumbhakamalaha. So Kalantara Khari Bhutva Krichirasyat Kumbhakamalaha, it is said. So after a certain time of thing, if cirrhosis of a liver or regular liver disease or Kamala, if it is not treated properly with proper medication, then the person may land up in trouble and the organ may become Khaributva, becomes totally solidified, and he resulted in a form of cirrhosis or Kumbha Kamala. All this explanation has been given in the classicals. So based on that, taken this case has been taken as Kumbha Kamala, and in this, the first line of treatment would be straight away Nityame Virechiyat and Dugdapana. So usually I do come across these type of patients every now and then. So in that, as a routine practice, I do this with Nityame Virechiyat. So for Nityame Virechana, I select in many of the cases some of the capsules like Purilax, which contains Shodhita Jayapala also to some extent, and even St. Madhu and Triphala, all these combinations are there in that, which is a very good purgative for me. In some cases, when I feel there is a criticality is there, or patient is weak comparatively, or Sukumara is also there, or even Dhatuksha is more, then I do take a little bit of caution not to use that accordingly. So in this case, I tried with Haritaki Churna. 1 spoon of Haritaki Churna, mix it with 2 spoons of Jaggery, Guda. So this has been given in the morning, and patient started losing his body weight, and there will be Anulomana even as well as Kosta Shodhana, and regular there will be loose stools or bubbles will happen. So with this, within a short span of 18 days, his protruded belly has come down to normalcy, and after almost 70 days or 80 days, now his LFT levels are almost nearing to normal, and all his parameters of related with the chronic liver disease has almost come to the normalcy. And in this case, we have treated with Pittare Chakwata and Livact, a capsule containing the Patola Koturoine, the combinations, and all the drugs which are very specially targeting at the liver, and even the drugs like Arogyavardhini is also been there, and of course some nutritive materials I have added. And importantly, in this patient, I usually keep them on totally milk diet. In Ayurveda, for these type of Jalodhara patients, very clearly it is mentioned we need to give Ustri Dugdha, a camel's milk. But of course, it cannot be available everywhere. So best alternative is cow milk. So we suggest them, or I suggest them usually to these type of patients to go on totally on cow milk. So with that, maybe around, depending upon person to person, in this case, I have suggested almost 1.5 liters of milk per day, because our intention was to bring back the protein loss. So you can observe that in Jalodhara, there is a lot of peritoneal free fluid which is lost. It is not only the water content of the body, but it is also a protein. So we are losing a lot of protein. We need to replenish, or we need to replace those lost protein. So that is the best option is milk. That's why our acharyas have given very clearly the concept of dugdapana. So in this patient, I keep them on continuously, repeatedly, for whenever they feel hungry or thirsty, they need to go for dugdapana. I restrict them not to take water. I just usually keep it them on 500 ml of water per day for all purposes of drinking. And other than that, whenever they feel, let them have milk. So usually 1.5 liters to 2 liters of milk will be provided to them, and that is the process. So in this process, he has totally within a short span of 18 to 20 days, and this condition has been relieved. And now, of course, even the blood parameters, as well as even the prothrombin time and even LFT is also as coming to normalcy at the time of around 70 days. By usually in these type of cases, I have seen around it takes 100 days to settle down fast. Once it is settled down by 100 days, then it can be maintained for next another 100 days. So by the time he will be almost out of danger. So this is the total case of Kamala treated on the lines of Ayurveda. Of course, it's not a first case. There are many such cases of Kumbhakamala. Of course, not all the cases will end up in good results. Sometimes it goes beyond our control. So we need to be very cautious in doing handling these diseases. Of course, we need to take a very good consent signature by the signed by the patient relatives and as well as the patient, and do the treatment. So this is what I have done in this case.